Muted.
C'est moi qui commence, François-Philippe.
I'm starting, François-Philippe.
Hello everyone, bonjour à tous. Je suis content d'être ici avec la docteur Tam et le docteur Njoo, ainsi que les ministres Champagne, Anand et Hajdu. Aujourd'hui, je veux vous parler de la situation actuelle en ce qui concerne la livraison des vaccins, les règles de santé publique et nos investissements à long terme dans la biofabrication ici, chez nous. Commençons par la livraison des vaccins. This week, we're receiving 4.5 million vaccine doses, including a shipment from Pfizer that has been moved up ahead of the holiday weekend. 4.5 million doses is our largest weekly shipment to date, and it'll help Canada keep within the top of the G20 on daily vaccinations, where we've been for over 2 weeks. In fact, because of the number of vaccines arriving, yesterday, Ontario announced that anyone over 18 can sign up for a vaccine appointment starting today. To everyone who's been waiting patiently so that your parents and grandparents could go first, thank you. Thank you for hanging in there, but also thank you for now booking your appointments. Hospitals, pharmacies, and healthcare staff are all doing an incredible job rolling out vaccines to everyone. So I want to give another big shout out to all frontline workers who are part of this effort. With millions of vaccines arriving each week, getting doses into arms is a true Team Canada effort. With the leadership of people like Brigadier General Krista Brody, who's now heading up vaccine logistics and operations at the Public Health Agency, we're going to get this done. Brigadier General Brody had already played a key role in the vaccine rollout with the Public Health Agency. She, along with the team that's been there since day one, is ready and able to get millions of doses to Canadians in the coming weeks. On that note, this morning, I also want to share some very positive news about our vaccine deliveries for the summer. I can confirm that we'll receive 9 million doses of the Pfizer vaccine in June alone. That means that between now and at least the end of July, we'll continue to get over 2 million Pfizer doses a week. Aujourd'hui, je peux confirmer qu'on va recevoir un total de plus de 9 millions de doses de Pfizer en juillet. D'ici la fin juillet, on va continuer de recevoir plus de 2 millions de doses de Pfizer chaque semaine. La vaccination progresse rapidement. Cette semaine, on va recevoir 4,5 millions de doses, notre plus grand nombre de doses en une semaine à ce jour. Ces doses vont contribuer à maintenir le Canada dans les premiers pays du G20 en matière de vaccination quotidienne, une place qu'on occupe depuis 2 semaines déjà. Ces nouvelles sont encourageantes et voici ce que ça signifie pour vous et votre famille. This summer, once cases are low and at least 75% of people have had one dose and 20% have had a second, you can look forward to outdoor things like a small get-together in a backyard, going hiking, or sharing a meal on a patio. This fall, once 3/4 of eligible Canadians are fully vaccinated, we'll be able to do more of the indoor things we miss, whether that's watching sports in person or a dinner party in a restaurant. That's what a 1-dose summer and a 2-dose fall could mean for you and your family. We worry less, and we see each other more. And to get there, here's what we all need to continue to do right now. First, keep following the current public health restrictions for a few more weeks. Things can't open back up until cases are way down. Otherwise, we risk a fourth wave. Second, and this is key, get your vaccine. We can all help get back to the things we love by being vaccinated. Notre priorité est d'assurer votre sécurité et celle de votre famille. À court terme, on doit vaincre la COVID-19. Et à long terme, on doit bâtir un avenir plus sain et plus prospère. Aujourd'hui, j'annonce qu'on va investir près de 200 millions de dollars dans la compagnie Résilience Biotechnologie afin de renforcer notre capacité de fabriquer des vaccins et des produits thérapeutiques ici au Canada. En soutenant des installations et des compagnies pour qu'elles puissent travailler avec des nouvelles technologies, on positionne le Canada à la fine pointe de l'innovation dans le monde entier. Et c'est essentiel pour qu'on soit prêt à faire face à toute crise sanitaire future. Today's investment of almost $200 million in resilience biotechnologies will not only boost Canadian manufacturing, it will also support good Canadian jobs. This funding will maintain and create 500 well-paying, full-time jobs at the Resilience Facility in Mississauga, positions that people can rely on to provide for their families. It will also mean 50 co-op spots, which will help young people get their foot in the door in a growing sector. To rebuild from this pandemic, we're investing in Canada, in workers, in innovation, and in the future. Que ce soit pour créer des emplois dans le secteur de la biofabrication ou soutenir les entrepreneurs, on a un plan pour rebâtir un Canada plus fort et plus sécuritaire pour tous. La dernière année a été difficile, mais des jours meilleurs nous attendent. Merci. Je cède maintenant la parole au ministre Champagne. François-Philippe.
Thank you, Prime Minister, for the introduction. Bien heureux de me joindre à vous aujourd'hui à partir de Shawinigan. Comme le Premier ministre l'a souligné, nos objectifs durant la pandémie ont été clairs. D'abord, de protéger la santé et la sécurité des Canadiens et des Canadiennes, et aussi de nous assurer que nous serons plus résilients pour le futur. To fully appreciate the importance of today's announcement, as outlined by the Prime Minister, we simply need to look to the past. As we have seen, our biomanufacturing sector had been in decline for almost 4 decades. At the outbreak of the pandemic, we lacked the capacity needed to attract the mass production of COVID-19 vaccines. But one thing is clear, Canada is well positioned to grow its leadership in the life sciences sector. We have the talent, we have the entrepreneurs, and we have the ecosystem to help this sector grow. That's why we have taken strategic immediate action with the long-term vision as we outline with the announcement today. Since March 2020, we have invested well over $1 billion in rebuilding our domestic biomanufacturing sector. And in budget 2021, we doubled down on this commitment with $2.2 billion towards growing a vibrant domestic life sciences sector again. We are helping dozens of Canadian firms expand and are attracting foreign investment in Canada, as we are announcing with Resilience today. Nos investissements permettront d'accroître la compétitivité du Canada à l'échelle internationale dans le secteur des sciences de la vie. Ce qui nous amène, bien évidemment, à l'annonce d'aujourd'hui. Nous sommes heureux d'annoncer que nous investirons $199 millions dans la compagnie Résilience Biotechnologie pour moderniser et agrandir leurs installations à Mississauga dans un projet d'une valeur totale de plus de $400 millions canadiens. Une fois complétée, la nouvelle installation pourrait fabriquer entre 112 et 640 millions de doses de vaccins ARNM par année. Cela positionnera le Canada comme juridiction de choix pour attirer la production de vaccins destinés au marché domestique et même aux exportations. As the Prime Minister noted, we are investing $199 million in Resilience Biotechnologies to modernize and expand their facilities in Mississauga, which will support an overall project of more than $400 million. Once completed, the new facility is expected to be able to manufacture between 112 million and 640 million doses of mRNA vaccines per year, a significant boost to our domestic capacity. This will position Canada well to attract vaccine manufacturing for both the Canadian market and the export market. This investment is also very good news in terms of jobs and opportunities for Canadians, because the company has committed to keep 500 of these jobs in Mississauga for the next 25 years. All in all, this investment is good news for Mississauga, good news for Ontario, and good news for the growing life sciences ecosystem all across Canada. Today's announcement is further proof that our country, and indeed our efforts, which are led by the Prime Minister, are attracting major investments in this sector, as we have seen over the last few months. I want to say congratulations to everyone on the resilience team. We are excited to be supporting you in this very important project, a project that will create jobs, a project that will increase our resiliency, and a project that will support our economic growth plan. Avec ça, je vais maintenant passer la parole au Dr. Tam. Madame le docteur, la parole est à vous.
Dr. Tam. Dr. Tam, you have the floor.
Bonjour à toutes et à tous. Nationally, disease activity continues to decline, but there are still some areas of Canada experiencing very high infection rates. Over the past 7 days, an average of 5,700 cases have been reported daily, and the number of people experiencing severe and critical illness remains elevated. On average, over 3,600 people with COVID-19 were being treated in our hospitals each day, including over 1,300 in intensive care units, and there were an average of 43 deaths reported daily. Nevertheless, we are making steady progress, with a 25% decrease in reported active cases since the peak of the third wave in mid-April. Last week, we had more encouraging news, including significant increases in vaccine supplies and expansion and innovation of vaccination programs across the country that are helping to protect as many Canadians as possible faster. On Sunday, the Thorncliffe Park Vaccination Clinic in East York achieved a great milestone and a Canadian first in vaccine delivery by providing over 10,000 people with a dose of COVID-19 vaccine in less than 24 hours as a single clinic location. At the same time, regulatory and expert authorities in Canada continue to assess the evidence for safe, effective, and optimized use of COVID-19 vaccines in Canada. Following Health Canada's authorization of the Pfizer-BioNTech COVID-19 vaccine for use in children aged 12 to 15 years on the 5th of May, Canada's National Advisory Committee on Immunization has completed their expert review with new advice for federal, provincial, and territorial governments released today. NACI recommends that a complete series of 2 doses of the Pfizer-BioNTech COVID-19 vaccine can be offered to individuals 12 to 18 years of age who are eligible to receive the vaccine. The coming weeks and months hold great promise. Accelerated vaccine rollout will return greater benefits if we maintain caution while allowing the vaccines time to build our protection. Many of us are achieving priming protection from our first dose of vaccine during the spring and summer months, to be followed by our second immunity boosting dose that will maximize protection. During this time, as immunity builds up across the population, it is very important to continue following local public health advice, including about when and where to maintain essential precautions such as masking and spacing. This will help us stay healthy while allowing us to safely enjoy more activities and small reunions outdoors. Importantly, this cautious approach will also set us up for a better fall. Maintaining our progress to reduce infection rates down to manageable levels, ease pressure on the health system, and re-establish public health capacity will put us in a better position to prevent a fall resurgence. Working together, we can end this pandemic and get back to the connections and activities that enrich our social and economic life and well-being in Canada. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello,
À
everyone.
l'échelle nationale, la transmission
Nationally,
de la maladie
disease
continue
activity
de diminuer
continues to
et
decline,
certaines régions
but
du
there are
Canada
still
connaissent
certain
encore des
areas of
taux
Canada
d'infection très
experiencing
élevés. Au
very
cours des
high
7 derniers jours,
infection rates.
5
Over
700
the
cas
past
en
7
moyenne ont
days,
été
an average
signalés
of
chaque jour et le nombre de
5,700
cas
cases
graves et
have been
critiques
reported
reste
daily.
élevé.
the number
En
of
moyenne,
people
plus de
experiencing
3
severe and
600
critical
personnes atteintes
illness
de la
remains
COVID-19
elevated.
ont été
On
traitées dans
average,
nos
over
hôpitaux chaque
3,600
jour,
people with
dont plus de 1
COVID-19
300 aux
were
soins
being treated
intensifs
in our
et
hospitals
43
each
décès
day,
ont été
including
signalés
over
en moyenne quotidiennement.
1,300 in
Néanmoins, la
ICUs.
situation
There
s'améliore
was an
constamment
average of
avec
43
une
deaths
diminution de
reported
25
daily.
des cas actifs
Nevertheless, we are making
signalés
steady
depuis le pic
progress
de
with
la
a
troisième vague
25%
à la
decrease in
mi-avril.
reported active
La semaine dernière,
cases since
nous
the
avons
peak
eu d'autres
of the
nouvelles
third wave in
encourageantes,
mid-April. Last week, we had
notamment une
more
augmentation
encouraging news,
importante des stocks
including
de vaccins.
significant
Nous avons
increases in
également
vaccine
stimulé
supplies
l'expansion
and
et l'innovation
expansion
de
and
programmes de
innovation
vaccination
of
dans tout le
vaccination
pays
programs
qui
across the
contribuent à
country.
protéger le plus grand
They are
nombre
helping to
possible de
protect as
personnes
many
plus
Canadians
rapidement.
possible
Dimanche
faster.
dernier,
On
la clinique de
Sunday,
vaccination
the
de
Thorncliffe
Thorncliffe
Park
Park de East
Vaccination
York a
Clinic in
battu
East
un
York
record et réalisé une
achieved a
première
great
canadienne
milestone
en
and a
matière de
Canadian
vaccination
first in
en
vaccine
vaccinant plus
delivery.
de 10 000
It
personnes contre
provided
la
over
COVID-19 en
10,000
moins de
people
24
with a
heures dans
dose
une
of
seule clinique.
COVID-19 vaccine
Par ailleurs,
in less
les
than
autorités
24 hours
réglementaires
at a
et les
single
experts au
clinic.
Canada
At the
continuent
same time,
d'évaluer les données
regulatory and
concernant une
expert authorities in
utilisation
Canada
sûre,
continue to assess
efficace
the
et
evidence
optimisée
for
des
safe,
vaccins
effective,
contre la
and
COVID-19 au
optimized use
pays.
of
À la
COVID-19
suite de
vaccines in
l'autorisation
Canada.
donnée par Santé Canada
Following Health Canada's
relativement à
authorization
l'administration du vaccin contre la COVID-19 de Pfizer-BioNTech chez
of the
les enfants
Pfizer-BioNTech
âgés de 12 à
COVID-19
15 ans
vaccine for
le
use
5
in
mai
children
dernier,
aged
le
12 to
Comité
15.
consultatif
That was
national
on
de
May 5th.
l'immunisation du Canada
Canada's National Advisory Committee
a terminé son examen
on
d'experts et a publié
immunization has
aujourd'hui de
completed
nouveaux
its
conseils à
expert
l'intention
review,
des
with
gouvernements
new
fédéraux,
advice for federal,
provinciaux et
provincial, and
territoriaux.
territorial
Le
governments released
CCNI recommande
today.
qu'une
The
série complète de 2
NACI
doses de vaccins
recommends that a
contre la
complete
COVID-19
series
de
of 2 doses of the
Pfizer-BioNTech puisse être proposée aux
Pfizer-BioNTech
personnes âgées de
vaccine
12 à
be
18 ans
offered,
qui sont
can be
admissibles
offered
à
to
recevoir le
individuals
vaccin.
12 to 18
Les
years of
semaines et les
age who
mois
are
à
eligible.
venir sont très
The
prometteurs.
coming weeks
Une
and months
campagne de
hold great
vaccination
promise.
intensive
Accelerated
apportera de
vaccine
plus grands
rollout will
avantages
return with
si
greater
nous restons
benefits
prudents
if we
tout en laissant au vaccin le temps
maintain
de
caution
renforcer notre
while allowing the
immunité.
vaccines time
Bon
to build
nombre
our
d'entre
protection.
nous
Many
bénéficieront
of us
ou
are achieving
bénéficieront d'une protection
primary
primaire provenant
protection
de la première
from our
dose
first dose of
administrée
vaccine
au
during the
printemps
spring
et à
and
l'été,
summer
qui
months.
sera suivie d'une
It will be
seconde
followed by
dose,
our second
dose de rappel destinée à
immunity-boosting
stimuler
dose
l'immunité
that will
et à maximiser la
maximize
protection.
protection.
Pendant cette période,
During this
alors que
time, as
l'immunité
immunity builds up
s'accroît dans la
across the
population,
population,
il est très
it is
important
very
de
important
continuer
to
à suivre
continue
les conseils
following
de
local
santé
public
publique
health
locaux,
advice,
notamment en
including
ce qui
about
concerne
when
les
and
moments
where
et
to
les
maintain
endroits où
essential
il faut respecter
precautions
les mesures
such as
essentielles
masking
comme le
and
port de masque
spacing.
et la distanciation physique. Ces gestes nous aideront à
This will
rester
help
en
us stay
santé
healthy
tout en
while
nous
allowing us to
permettant de
safely enjoy
profiter en
more
toute
activities
sécurité
and
de
small
plus
reunions
d'activités et de
outdoors.
nous réunir en petit nombre à l'extérieur. Il est important de noter que cette
Importantly,
approche prudente
this cautious
sera gage d'un automne plus
will
agréable.
also set
En
us up for a
continuant sur
better
cette
fall,
lancée pour ramener les taux
maintaining our
d'infection
progress
à des niveaux
to reduce
gérables,
infection
pour
rates down
alléger
to
la
manageable
pression sur le
levels,
système de
to
santé
ease
et
pressure
pour
on the health
rétablir le
system,
rendement de la
and to
santé publique, nous
establish
serons
public
mieux
health
à même de
capacity will
prévenir
put
une
us in a better
recrudescence
position
à
to
l'automne.
prevent a fall
Ensemble,
resurgence.
nous pouvons
Working
enrayer cette
together, we
pandémie
can
et
end this
retrouver notre
pandemic and
entourage et
get
nos
back to the
activités
connections and
qui nous procurent
activities
un bien-être
that enrich
et
our social
enrichissant
and
notre vie
economic life
sociale
and
et
well-being
économique
in
au
Canada.
Canada.
Thank you.
Merci.
Thank you, Dr. Njoo. The PM will be answering 6 questions, 1 question, 1 follow-up. Ministers and doctors will remain another 15 minutes to answer more questions, starting with the phone. Merci, Dr. Njoo. Le Premier ministre répondra à 6 questions, une question, une sous-question. Les ministres et docteurs demeureront disponibles pour un autre 15 minutes par la suite, en commençant par le téléphone. Opératrice, c'est à vous.
Thank you. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. Notre première question nous vient de Mélanie Marquis de La Presse. À vous la parole.
First question from La Presse newspaper.
Merci. Bonjour, M. Trudeau.
Thank you.
L'avocat du
Question.
major général Danny Fortin
Major General
a
Danny
dit
Fortin's
hier
lawyer
que
said
le major
yesterday
général Fortin savait
that
depuis quelques semaines
Major
qu'il était
General
visé
Fortin
par une
knew
enquête
for several
militaire.
weeks that he had
De
been,
votre côté, quand saviez-vous et quand l'avez-vous
source of
appris pour la
When
première
did
fois?
you learn this for the first time?
Merci, Mélanie.
Answer.
D'abord, comme
you.
toujours, mes premières pensées
As
sont
usual,
pour les femmes et les hommes qui
thoughts,
servent
my first
au sein de nos
thoughts
forces
are
armées,
always
qui
for
ont
the
besoin
victims
toujours d'avoir le
of the
soutien et
Canadian
l'appui
Armed Forces who need to
de
have
nos institutions,
the support,
particulièrement quand
necessary support,
il vient le temps de
especially
rapporter
when it
des
comes
allégations
time to
d'actions ou
report
des
allegations
plaintes. Nous allons toujours
or
être là pour eux.
complaints. We will always be there for them.
Dans cette situation, les autorités responsables et le leadership militaire sont en train d'engager un processus. Quand ils font ça, ils jugent des fois que c'est approprié d'informer mon bureau et j'ai été informé il y a plusieurs semaines. Mais évidemment, parce que c'est un processus qui se découle de façon indépendante, je n'ai pas reçu beaucoup de détails, ce qui est tout à fait approprié. Et en plus, je ne peux pas commenter là-dessus. Mais je peux vous dire que quand il y a des allégations, des préoccupations ou un suivi quelconque, moi et mon bureau, nous avons toujours deux préoccupations en tête. Qu'on s'assure qu'il soit suivi. D'abord, que l'enquête soit complète, rigoureuse et juste. Et deuxièmement, que si c'est une plainte par un individu, par quelqu'un, les souhaits de cet individu et les appuis pour cet individu soient mis en priorité. C'est toujours ce que nous allons regarder dans quelle que soit la situation. Nous nous attendons aussi que les processus se découlent de façon rigoureuse et indépendante. Mais je veux souligner que ce qui préoccupe beaucoup de gens, évidemment, c'est la vaccination continue. Et dans la personne de la brigadière générale Brody, on a quelqu'un qui va pouvoir continuer avec toute l'excellence auquel on s'attend, la livraison de vaccins à travers le pays. First of all, I want to obviously express, as always, my total support for women and men who serve in the armed forces, who deserve to serve in safety, in secure environments, and also to have the supports necessary if ever they are to come forward with concerns and allegations. In regards to this situation, it is being led and followed up appropriately by appropriate authorities and military leadership. In situations like this, those authorities can make a determination to inform me in my office, which they did in this case a number of weeks ago. However, because, as is appropriate, I didn't receive details of what is being alleged and what's going on in terms of the investigation, it would be inappropriate for me to comment on that investigation. But I do want to remind people that whenever we are apprised of situations like this, I have two main priorities. First of all, that the investigation be complete, be rigorous, and be fair. And secondly, that if it's a situation where there are concerns because someone came forward, that the wishes and supports for that complainant be always top of mind as we go through the process. At the same time, I can reassure Canadians that our vaccination rollout, particularly this week where we are receiving record numbers of vaccine doses, our vaccine rollout continues and is in excellent hands with Brigadier General Brody and her team, who will continue to ensure that Canadians get vaccinated as quickly and as safely as possible.
En suivi, Mélanie?
Oui, en suivi, qu'est-ce qui a changé, donc, M. Trudeau, entre le moment où vous avez été informé, donc il y a quelques semaines, que M. le major général Fortin faisait l'objet d'une enquête et l'annonce de son départ un peu subi vendredi soir. Et puis, je vais essayer de poser la question sans me faire tirer des roches, là, mais pourquoi est-ce qu'on ne divulgue pas certains faits pour démontrer que la suspension est justifiée? En ce moment, on parle d'une allégation qui remonte à 1989 d'exhibitionnisme, mais il y a quand même des rumeurs qui s'emballent, puis on peine à saisir quand même l'ampleur, la
We're
gravité
having
des
trouble
gestes qui ont
understanding
mené au départ
the
de
scope
M.
of the
Fortin.
gestures that Major General
Je comprends
Fortin is
entièrement
alleged to
ces
have done.
questions, Mélanie, et
Answer.
je
I
peux
fully understand
partager
your
évidemment
questions,
que c'est une
and
situation
I can tell you that
qu'on
this
ne
is a
voudrait pas être en train de
situation
vivre
that we do
maintenant
not
au
want
milieu de,
to obviously have,
ce moment particulièrement important,
especially right
mais
now.
c'est aussi évidemment
But of course,
extrêmement
it's
important
also
de
obvious and
prendre au
extremely
sérieux
important to take it seriously.
quand il y a des préoccupations. Par rapport aux décisions spécifiques,
With
comme j'ai
regard to the
souligné,
specific decision,
c'est les
I
autorités
can
responsables,
say
c'est
that the
le
authorities
leadership
in
militaire qui a la charge
military
de ce
leadership
processus. Nous en
took
avions
this
été
process on.
avisés,
We were
mais
advised
c'est
that
pas
the
du tout
process
moi
had
ni
been
mon
undertaken,
bureau
but it is
qui
not
se penche
my
sur ce
role nor my
processus.
office's
Donc ces
role
questions-là, c'est des
to
questions plus appropriées
oversee this
pour les
process.
autorités
These
en place.
questions would be more appropriate for the authorities.
I understand all these questions, and they're very legitimate questions, Melanie. This is also not an ideal situation to be in, particularly in this moment of crisis, in this moment of importance on the vaccine rollout, but it is really, really important that we have proper processes in place and that any concerns be followed up on. That is what all Canadians expect, regardless of the situations we're in. And that's what's being done in this situation. This is not an investigation out of my office or out of the Privy Council. It's being handled by military leadership and the appropriate authorities. So I can't give the more specific answers that you're looking for, but I would understand that people have questions and are hopeful that this process is going to be, as I highlighted my desire for it to be, fair, complete, and rigorous.
Thank you. Operator, next question on the phone.
Our next question is from Tanda McCharles from the Toronto Star. Please go ahead.
Yes, hi, Prime Minister. I wonder if you can speak then to a couple of things. Given that this seems to be an allegation that came forward possibly 2 months ago, you said a number of weeks ago that you found out. Given that you are in what you call an important moment in the pandemic, what do you make of, what is your opinion of what maybe seems like to the outside foot dragging on this investigation? Why wasn't it addressed very quickly? Why wasn't General Fortin, for example, given specifics of the allegation he's facing until Sunday by a reporter?
Again, Tanda, I totally appreciate those questions. They are real questions that people are asking themselves. In this situation, like I said, I was apprised that there were concerns a number of weeks ago. My role and my office's role is to ensure that everyone knows that the proper processes need to be followed, that the wishes of any complaining parties need to be respected and supported, and that these measures be taken seriously with rigor and with fairness. I cannot speak to the details of these allegations, in large part because I wasn't given the details of these allegations, because it would not be appropriate for me to be following that closely an independent investigation like this. But I can assure you that we are very attentive to the fact that proper process be followed in this as in all cases.
I'm wondering how you can describe your confidence that a proper process is being followed, given that it seems like there's a firewall between you and the military, and this seems to be something that's been afoot for 2 months. And so if the allegation is founded, then you've had a leader in position that presumably you wouldn't have wanted him to be. If the allegation is unfounded, now his reputation may be at stake. So I'm just curious, how have you assured yourself, given what seems to be a firewall between you and the military, that a proper, rigorous investigation is being undertaken and a fair one?
You have highlighted, Tanda, the very real challenges and important factors to consider and to keep an eye on in any such process. Absolutely. We need to make sure that the process is fair for everyone involved and that it is complete and rigorous. That's why the communications and the leadership of the military has been focused on this, and my office and the Privy Council office have been engaged with the appropriate authorities to impress upon them the importance of following the proper, rigorous processes and ensuring that all appropriate steps are taken. Je pense que c'est très important ce que vous soulignez, Tanda, par rapport aux différentes réflexions de s'assurer qu'il y a un processus juste et équitable, mais aussi que ce soit rigoureux et que ce soit conduit de la bonne façon. C'est pour ça que moi et mon bureau, nous avons passé le message très clairement par la greffière du Conseil privé et directement au chef des forces armées, que dans leur processus qui sont appropriés, qui sont en place pour faire des suivis, que tout soit suivi à la lettre, que tout soit fait de la bonne façon.
Merci. On va prendre une dernière question au téléphone avant de passer dans la salle.
Merci. Notre prochaine question est de Marie Vastel du Devoir. À vous la parole. Please go ahead.
Oui, bonjour, M. Trudeau. J'aimerais changer de sujet, si vous me le permettez. Je voudrais revenir sur la réforme de la loi 101 déposée par le gouvernement du Québec la semaine dernière. On ne vous a pas entendu et vos ministres, jusqu'à présent, ont refusé de commenter en voulant prendre le temps de voir le projet de loi. Maintenant que ça fait presque une semaine, j'espère que vous avez peut-être un petit peu plus à dire. Le gouvernement Legault a annoncé qu'il va modifier la Constitution, notamment pour inscrire que le Québec est une nation et que le français est la seule langue officielle du Québec. J'aimerais savoir si votre gouvernement est aussi d'avis qu'une province peut modifier à elle seule, de façon unilatérale, la section provinciale de la Constitution. Est-ce que votre gouvernement a la même interprétation quant à savoir quels amendements sont possibles de façon unilatérale?
Merci Marie. D'abord, comme vous savez, nous partageons avec le gouvernement du Québec le même intérêt, le même désir de voir le français protégé au Québec et en plus partout au Canada. C'est une responsabilité particulière du gouvernement fédéral et nous allons toujours être là pour protéger le français et au Québec et ailleurs au Canada, tout en assurant la protection des minorités linguistiques officielles à travers le pays, ce que nous allons faire. Par rapport à la capacité de modifier la Constitution en ce qui a trait à une province en particulier, effectivement, ce que nous comprenons par nos analyses initiales, c'est que effectivement, le Québec a le droit de modifier une partie de la Constitution pour souligner d'ailleurs des constats que nous avons déjà faits au niveau du gouvernement fédéral, c'est-à-dire que le Québec consiste d'une nation et que c'est une province où la langue officielle, c'est le français. Nous allons évidemment nous assurer qu'on est en train de respecter les protections qui sont là ailleurs dans la Constitution, particulièrement pour les anglophones au Québec. Mais je crois qu'il y a beaucoup de travail que nous allons pouvoir faire ensemble, le gouvernement fédéral et le gouvernement du Québec, pour avancer sur la protection de la langue française, qui est quelque chose sur lequel nous sommes d'accord. I think it is extremely important first to highlight that we agree with the province of Quebec on how important it is to protect the French language. Yes, there are particular measures that need to be done to protect the French language within Quebec, but also, as the federal government has responsibility, right across the country. That goes hand in hand, of course, with the protection of linguistic minorities across the country, which we will continue to do. In regards to the Constitution, our initial analysis in terms of the Justice Department has highlighted that it is perfectly legitimate for a province to modify the section of the Constitution that applies specifically to them, and that that is something that they can do while ensuring, of course, that the rest of the Constitution, including the sections that protect linguistic minorities like Anglophones in Quebec, continue to be respected. We will continue to move forward in ways that protect the French language, both in Quebec and across the country, and look forward to partnering with all governments across the country that share that goal with us.
En sous-question, Marie?
Oui, merci d'avoir donné une réponse avec de l'information. Mais je peux juste continuer là-dessus. Vous dites que, donc, ce que j'en comprends, puis dites-moi si je me trompe, c'est que vous allez donc accepter ces modifications constitutionnelles-là sans vous y opposer. Mais qu'en est-il du reste du projet de loi 96 de la CAQ? Vous dites que vous voulez aussi vous assurer que le projet de loi protège les anglophones du Québec. Vos ministres se sont fait demander la semaine dernière s'ils s'engageaient à ne pas contester le projet de loi québécois à laisser le Québec légiférer. Est-ce que vous allez jusque-là vous engager à ne pas contester tout le reste du projet de loi, ou est-ce que j'en comprends avec vos propos sur la protection des anglophones qui ont quand même certains éléments que vous surveillez plus attentivement qui pourraient vous poser problème?
D'abord, laissez-moi dire que on est d'accord avec le gouvernement du Québec qu'il faut en faire plus pour protéger la langue française. Mais nous, en tant que gouvernement fédéral, ce n'est pas juste une question de protéger la langue française au Québec, c'est une question de la protéger partout au pays aussi. Et à ce niveau-là, le gouvernement du Québec et nous nous rejoignons pas mal. Évidemment, c'est un projet de loi qui a été avancé à l'Assemblée nationale. Il y a un processus de comité, il y a un processus d'analyse, il y a des modifications possibles à ce projet de loi, malgré un grand niveau d'appui des différents partis à l'Assemblée nationale. Alors, nous allons regarder le parcours de ce projet de loi, mais je peux rassurer tous les Québécois et tous les Canadiens que nous allons être là en tant que partenaires pour s'assurer et de la protection de la langue française et de la défense des droits.
Merci. On va maintenant passer aux questions dans la salle.
Prime Minister Kevin Gallagher, CTV National News. I just want to take it back to the investigation into Major General Denny Fortin. I find your answers to be a bit vague here. You say weeks ago you found out. You've said that issues of sexual misconduct are zero tolerance for you. So the question is, why was Major General Fortin allowed to stay on with public health until Friday? When did you find out that this was an allegation of sexual misconduct?
First of all, I have highlighted that I have not been given a tremendous amount of details into this case because that would not be appropriate. There are official and independent processes underway in reviewing the case and reviewing the concerns that were brought forward, and they can speak to what needs to be made publicly. I cannot speak to too many details of this. I can highlight that this is a matter being followed up on by the military leadership and the appropriate authorities, that they made decisions along the way, and that we, from our position, are in a position of ensuring that, yes, the appropriate steps be followed, and that wishes of any complainants, if that is indeed the type of investigation this is, be respected and followed. I can't even confirm the type of investigation this is because that is not information that has been made public by the military yet.
Well, I think that we need to look maybe a bit broader here. I mean, now with Major General Fortin, at least half a dozen top military officials are under investigation for sexual misconduct. Your government 6 years ago had recommendations to address sexual misconduct in the forces from the Deschamps report, and very few of those recommendations were implemented. What responsibility do you take now for the crisis that is gripping the military?
I think we all share responsibility for this. The culture of tolerance of misconduct in the military has gone on for far too long, which is one of the reasons why, as a government, when we came into office 6 years ago, we took significant steps to accelerate the move towards creating better supports for survivors of sexual assault or anyone who comes forward. We have taken steps, but obviously, with what we're seeing now, there is so much more to do, which is why we appointed Justice Louise Arbour to lead up a review process to talk about the path going forward, and immediately appointed General Jenny Carignan to be able to create supports right now for anyone in the military who needs to come forward and wants to come forward and share unacceptable actions or issues that they have faced. It's really, really important that anyone who serves feels supported and and listened to as they come forward to share actions, experiences, inappropriate things that happened to them over the course of their career or in the past years.
Français sur la responsabilité.
Je pense que c'est extrêmement important de reconnaître que nous devons faire mieux en tant que pays, en tant que société, pour appuyer les survivantes et les survivants d'agressions. Depuis 6 ans, nous avons pris des gestes importants pour améliorer la situation, mais nous avons beaucoup plus à faire. C'est pour ça que nous avons demandé à la juge Louise Arbour de faire un suivi pour établir les prochaines étapes à suivre. Mais en même temps, on n'attend pas le rapport de Mme Arbour. On a mis en place la générale Carignan pour pouvoir être là, pour recevoir dès maintenant des préoccupations, des plaintes, des expériences inacceptables vécues par des gens qui servent actuellement dans les forces armées.
Prime Minister, I'm wondering if you can tell us whether you're aware of any other investigations into sexual misconduct, and if so, how many additional investigations are underway?
As I said, the investigation that is going on is being managed by the appropriate authorities and military leadership. In some cases, we are apprised of those situations, not necessarily in all cases, so I can't speak to how many investigations are going on. But what we have seen over these past months is that there is a pattern and there is a culture of unacceptable actions in the military that have gone on for far too long, which is why we are moving concretely on strengthening the supports for survivors, strengthening the processes in place to make sure that people who want to come forward are able to come forward, feel supported in coming forward, which for far too long was not the case. That is why between Justice Arbour and General Carignan in place right now, we are seeing an immediate shift, and people are coming forward with allegations, some of which go back many years, others which are more recent, and that is how the system should be working. It is going to be a difficult process for the military to transform its culture, but we know, everyone knows, that it is time. Je pense que c'est clair que ce qu'on est en train de voir dans les nouvelles depuis plusieurs semaines indique qu'il y a un vrai problème au sein des Forces armées canadiennes, que depuis trop longtemps, trop de femmes et d'hommes ne se sentent pas appuyés pour venir partager leur histoire, pour porter plainte contre des agressions et des gestes inacceptables. Et ça doit changer. C'est pour ça qu'on est en train de voir avec le nouveau processus qu'on a mis en place avec la générale Carignan et aussi avec l'engagement de la justice Arbour, la juge Arbour, que nous avons des processus qui sont maintenant plus accessibles et réconfortants pour des gens qui veulent porter plainte, que ce soit sur quelque chose qui est arrivé récemment ou depuis des années ou même des décennies. C'est important, mais ça va être difficile pour les forces armées de passer à travers ces moments. Mais nous savons, tous les Canadiens savent que c'est quelque chose par lequel il va falloir qu'on passe.
Bonjour, M. Trudeau, Louis Blouin de Radio-Canada. Vous dites que c'est important de changer le mécanisme pour les victimes, mais du même souffle, vous dites qu'en ce moment, les enquêtes qui sont en cours et tout ce qui se passe, ça doit être confié aux forces canadiennes. Comment pouvez-vous leur faire confiance avec tout ce qu'on voit en ce moment pour le traitement de ces enquêtes-là? On est rendu à une demi-douzaine de hauts dirigeants de l'armée qui sont sous enquête. Est-ce que ce n'est pas le moment de retirer ces enquêtes-là dès maintenant des mains du haut commandement de l'armée? Pourquoi attendre?
On sait qu'on est dans une situation extrêmement difficile, mais aussi importante, où on fait les processus nécessaires. Depuis très longtemps, les forces armées ont des capacités de faire des enquêtes, des suivis sur des préoccupations et des comportements de leurs membres. On a vu, en même temps,
to
que par
investigate
rapport
its
aux
members,
plaintes d'agression
but we've
sexuelle,
seen that
par
with
rapport aux
regard to
plaintes
sexual
d'harcèlement,
harassment
ils n'ont pas
complaints,
toujours été
the
très
Canadian Armed
bons
Forces
là-dedans.
has not
C'est pour
always
ça que,
been
justement,
good at doing
on
its
est en train
job
de
of
travailler
investigating.
avec
That's
des
why
hauts
we
placés
are
dans
working
les forces armées et
with
à l'extérieur des
the
forces
upper
armées
ranks of
pour
the Canadian
s'assurer
Armed
qu'il y a
Forces
des meilleurs processus en place
to
dès
ensure
aujourd'hui, que ce soit
with
avec
them
la
and with
générale
others to ensure
Carignan,
that there are
que ce
better
soit avec la
processes
juge
in
Arbour.
place
Nous sommes en
with
train de
General
s'assurer que ces
Carignan,
processus
with
soient
Justice
pris au
Arbour.
sérieux et
We
qu'ils
are
soient
ensuring
suivis
that
de la bonne
these
façon.
processes are taken seriously and done properly.
I think it is obvious that within the military, including within the military investigations approach, that have a robust system of investigations into crimes and issues that are internal to the military, have not always been very good about supporting survivors of sexual assault, following up on claims of sexual harassment, and that is something that we need to significantly improve. That's why we're working both within the armed forces with allies and leaders who get that and who are transforming things from the inside, as is General Carignan, but also bringing in someone of the caliber of Justice Arbour, who will ensure that the structures and the processes in place are the ones that will ensure that all of these issues are taken seriously, treated fairly, and that survivors are given proper listening and proper support.
Prime Minister Tom Perry, CBC. On the situation in the Middle East, Canada has called on both sides in the current conflict to move toward ending the violence, but there have been calls for the Palestinians. Where does Canada stand on that? The Palestinians, they're going to be going to the General Assembly to try and get some kind of resolution on this. Where would Canada stand on that if it goes before the UN General Assembly?
First of all, our hearts go out to Israelis and Palestinians for the violence that is surrounding them right now. We've all seen the tragic images, families, innocents, kids affected. It needs to stop. That's why Canada is calling for a ceasefire. That is why we will work with the international community to de-escalate the situation and to move forward so that there is no more loss of civilian life. On est de tout cœur avec les Israéliens et les Palestiniens qui vivent des moments extrêmement difficiles maintenant. On a vu les images de violence sur des familles, sur des innocents, sur des enfants. Ça doit arrêter. C'est pour ça que le Canada est en train d'appeler pour un cessez-le-feu et on va travailler avec nos partenaires à l'international pour qu'il y en ait un.
And we are working
last question.
with the international community.
Hi, Prime Minister Chris Reynolds, Canadian Press. I'm hoping you'll indulge a double-barreled question here. First, polls indicate that Canadians are not as enthusiastic as some U.S. lawmakers when it comes to reopening the Canada-U.S. border. So I'm wondering what conditions you think Canadians want to see in place in order to expedite that process of unlocking the 49th parallel. And secondly, given all these allegations, these growing allegations against senior members of the Canadian Armed Forces, I'm wondering how comfortable you would be if your daughter, Ella Grace, told you that she wanted to join the military.
First of all, in regards to the Canada-U.S. border, we continue to work very closely with American authorities and with Canadian experts on how we can move forward in a way that is safe for Canadians. We know that we are not yet out of this third wave. We know that there are still real concerns around transmission of the virus, but we will continue to work with our partners and hopefully get to a better place when the time is appropriate. We're all eager to get back to normal, but we know that before we get back to normal, cases need to be under control and over 75% of people need to be vaccinated for us to start loosening things in Canada. And we'll see what framework we apply to ensure that we're keeping Canadians safe, even as we look to eventually changing the restrictions and the posture at the border. In regards to my daughter, I hope my daughter is able to choose to do whatever she wants to do. when she grows up. She is filled with dreams and hopes like any little girl, like any child. And I would want to know that whatever workplace that she goes into, she will be treated fairly. She will not face discrimination or harassment. She will be paid as much as a man will, which is a big part of why we're so strong about moving forward on pay equity, which will come into force this summer. There are many, many things I wish for my daughter, but they are not different than that I wish for any daughter across this country. We have to do better, whether it's in the military or in corporate Canada or within our communities in fighting against gender-based violence. We have work to do, but I am confident that in the coming years, we will continue to deliver on a fairer world for everyone. Les espoirs que j'ai pour ma fille, c'est qu'elle puisse avoir tous les choix et possibilités de suivre ses rêves qu'on espérerait pour n'importe qui, que ce soit de travailler dans un bureau, de servir dans les forces armées, de devenir artiste ou scientifique. Elle, comme toutes les filles au Canada, mérite d'avoir un lieu de travail sécuritaire, où elle est libre d'intimidation ou d'harcèlement, où elle est payée autant pour un travail équivalent qu'un homme, qu'elle ne fasse pas face à la discrimination ou des iniquités. C'est pour ça que nous travaillons pour lutter contre la violence domestique et la violence fondée sur le sexe. C'est pour ça qu'on est en train de travailler pour changer la culture à l'intérieur de nos forces armées et de nos autres institutions. Et c'est pour ça qu'on avance avec notre projet d'équité salariale qui va s'enclencher cet été pour s'assurer que les femmes et les hommes soient payés pareil pour du travail pareil.
Merci beaucoup, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui. On va maintenant passer au téléphone pour les questions avec les ministres et docteurs. Opératrice, première question.
Thank you. Our first question is from Ryan Timothy from the National Post. Please go ahead.
Yeah, hi there. I'm wondering what the government is looking at with regards to the AstraZeneca vaccines that are in the country and that provinces have paused the use of right now due to the boycott issue. Some of these doses are coming closer to expiring, and there are countries around the world where COVID is very much a present reality and concern. Are you looking at something to ensure that those vaccines don't go to waste?
Maybe I can start and then turn to Dr. Tam to talk about the conversations with the provinces and territories about the immunization rollout. First of all, I think we've been clear with provinces and territories that doses shouldn't go to waste. Of course, we know that the provinces and territories have paused in many cases, and I think in all cases, the initial dose of AstraZeneca. But of course, we are still waiting for updated guidance from NACI on the potential of dose mixing, and provinces and territories are weighing their options very closely in terms of second doses for those people who have received AstraZeneca for a first dose. And until we know clearly what the decisions will be made based on the best science available, we'll be monitoring very closely our AstraZeneca supply to ensure that we have a path forward no matter what provinces and territories decide regarding the second doses. And perhaps I can turn to Dr. Tam because she is having those conversations at the Special Advisory Committee.
Yes, and I think as the minister said, that not wasting any doses is a really important principle. I do know that I think there was 655,000 doses that came in recently that is being allocated to provinces right now, or has been allocated, and they have really been thoughtful, I think, about what requirements are. Primarily making sure that those who've received one dose of AstraZeneca vaccine will have the option of getting the second dose, while, of course, awaiting the study results internationally. And I think we've seen a couple of those studies now, one from the United Kingdom. We're still waiting for some of the immunogenicity data that is to come. But you probably just read a little bit about a Spanish study, a study in Spain, that indicated that a dose of mRNA vaccine following AstraZeneca vaccine appears to be safe and generates really good antibody response. So the National Advisory Committee on Immunization will be looking at all of that data and provide a recommendation to the provinces. And so it is likely that people in Canada who've received one dose of AstraZeneca will have a choice for the second dose. At the same time, it's really monitoring the uptake, because we don't know what that is like at the moment, and don't sort of estimate what the requirements are, and just keep monitoring it very carefully. I think that's the only way to put it. But I think everybody's anxious to make sure people who got the first dose of AstraZeneca does have the ability to get that second dose.
Thank you. Following up, Ryan? Ryan, following up?
Yeah, hello?
Yeah, we can hear you.
I'm just wondering about today's announcement with resilience, whether you think that there's enough market for a vaccine mRNA plant like that in Canada, whether that will be able to attract consistent customers.
Well, thank you, Ryan, for your question. I think it's an exciting day. As you've seen, this is the first major investment of a CDMO in Canada of this scale. You may recall when we started in this pandemic, one of the challenges we were facing as a nation was the capability to attract vaccine manufacturer, because now, you know, a number of vaccine manufacturers, they focus on the research and development, but then they outsource the end-to-end manufacturing and fill and finish to other contractor. Resilience is one of them. Imagine we're going to a position where on average, we had a capacity around 30 to 35 million doses per year. And now we're bringing a player in Canada, which will help the whole, biomanufacturing sector in Canada. We've supported dozens of domestic manufacturers, but then now we're bringing an end-to-end manufacturer with a capacity to go to up to 640 million doses per year. And I just want to give you that in comparison to what you've seen in other countries is, when we said that we would be onshoring, that would be attracting investment in order to be more resilient. I think the fact that the company has decided to come to Canada, they had other choices, as you know, they manufacture, they operate in different countries, is a testament to what I've been hearing from a number of CEOs these days, that Canada is a safe bet, that we have the talent, that we have the ecosystem, and that we have the entrepreneurs to make sure that they would be successful. So an investment like that is obviously not only to make sure that we will be more resilient domestically, but to your earlier question, how can Canada contribute to better health around the world? And now when you have a capacity of that level, I think that bodes well for the future in terms of jobs, in terms of innovation, and certainly in terms of growth in our country.
Thank you, Minister Champagne. We'll take one last question on the phone.
Thank you. The next question is from Raymond Fillon de TVA. À vous la parole. Please go ahead.
TVA. Question inaudible.
Monsieur Fillon, on ne vous entend pas. Si je peux me permettre de vous interrompre, c'est le ministre Champagne. On ne vous entend pas malheureusement. Vous coupez. Je ne sais pas à qui vous vous adressez, mais si vous êtes capable de reprendre, on vous entend pas malheureusement.
La connexion est toujours mauvaise, Raymond.
Vous êtes saccadé dans votre voix.
Your voice is cutting off. We can't hear you properly.
Ce qui est rare.
Raymond, ça fonctionne toujours pas. On va prendre la question en appel pour te revenir un peu plus tard. Je vais maintenant passer aux personnes dans la salle pour les dernières questions.
Bonjour, Louis Blouin de Radio-Canada. My question is for Minister Hajdu. Can you reassure Canadians that the change in leadership in the distribution of vaccines will not affect the operation, since Brigadier General Brody will have some catch-up to do because she was away from the operation for a few months. So what can you tell us about the impacts on the vaccine distribution?
Merci pour la bonne question.
Thank you for the
Nous
excellent
avons une
question.
très forte équipe
We have a very strong
l'agence.
team,
Et je pense
and I
qu'ils
think
travaillent très fort pour Canadians.
that this
We
team
have
is
a
working
very
very hard for
strong
Canadians.
team at the Public Health Agency of Canada, and of course, Brigadier General Brody has the experience and the connections and relationships with the team, given her early role with the National Operations Center. Certainly, we're extremely thrilled to welcome her, and obviously the hardworking people in the National Operations Center are working on many aspects of the delivery to provinces and territories, and the day-to-day work continues. So we are very confident that we will continue to deliver in a timely way to provinces and territories, and that we won't miss a beat.
To go back to Major General Fortin, as a woman, as a minister of this government, are you at ease knowing that the Prime Minister did know for many weeks that there were allegations against Mr. Fortin, and that nothing was done, and that he was able to stay in place? How do you feel about that?
Well, first of all, I will just say that I can't comment on the investigation of Major General Danny Fortin, but what I can say is that as the health minister, I stay focused on what Canadians are focused on, which is when are they going to get their vaccine, how quickly, and how will we ensure that we control COVID-19 in this country. I serve with strong women around the table, one of them on this conference, and many men who support the strong women around this table, one of them on this conference. And indeed, as the Prime Minister has indicated, there are processes that unfold. But I will say this, I will always stand up for women in the workplace. In fact, as the Minister of Labour, it was me that introduced Bill C-65, which is harassment and violence legislation that ensures that every federally regulated workplace has policies and processes so that people who have felt harassment or violence in the workplace have a route to go away staffers. And I will point out that that was a decision our government made to protect political staffers, where previously to our government, they had no rights in the workplace. So as a woman in the workplace, my whole life, as a female health minister, I will say that it is important that we all take the responsibility that we have to make our workplaces safer. And this government has done that in legislative approaches and many other efforts, as the Prime Minister has illustrated.
Thank you. Next question.
Kevin Gallagher, CTV National News. This is most likely for Minister Hajdu, but also Dr. Tam, perhaps. Dr. Njoo could weigh in. It does have to do with the Stanley Cup playoffs. Some U.S. arenas are allowing fans back in the stands. I think that many Canadians would like to know if they're going to be able to see their team live during these playoffs, and if there's any plan for recommendations in terms of provinces and municipalities and how they'd like to deal with that.
Well, maybe I can start, and then I can turn it to Dr. Tam. And I'll just say that our approach to international professional sports will remain the same, in that we will not make those decisions unilaterally, but we'll work with the provinces and the local public health agencies to make sure that whatever the plan is, that local public health and provincial public health authorities have comfort in that plan. And of course, it will depend on the epidemiology of the region and the comfort level of the leaders in those particular jurisdictions. And I'll turn to Dr. Tam to speak a bit more about that.
It's Dr. Njoo. Do you want to go? Maybe I'll answer. I'm the sports guy, so I've been more actively involved in dealing with the sports-related issues of COVID-19. So what I will start off is that it's very exciting because with the sort of the season, the way it was organized, including the playoffs, it's guaranteed to be a Canadian team in the Final Four. So that's good news. So who knows? We'll take what we get and then go from there. certainly in terms of the playoffs as they're unfolding now, with the division, it's all sort of play with between teams in Canada. So all of the usual protocols in place, for travel between provinces and cities and so on are within sort of the existing public health measures that are put in place within Canada. The live issue, of course, right now is that what happens when we do get to the Final Four, and with what I think is put on the table, that would include cross-border travel, because the other three teams in the semifinals would be from the U.S. Sort of division. So that is a live issue. We've had discussions with our colleagues in the provinces and territories about the issue of cross-border travel. What's in the art of the possible? Certainly, we were recognizing, the epidemiological situation, what it is in both countries, also the state of vaccination. But there are a lot of other factors in place. So what I will say at this point is that the discussions are ongoing. I think in some ways the situation's the same as it was, way back last year when you asked me the same kind of question about playoffs, etc. In some ways it's different because now we have vaccines and there are other factors in place. So all I can say at this point is that there are lots of people looking at it. It's a matter under live discussion, and as the playoffs roll on, hopefully we'll come to some resolution that'll work. Thank you.
Thank you. We have time for one last question before ending this presser.
So do wait. I can go. I mean, I don't know if I did ask about fans, not about cross-border travel. That's all I'll say is that I think Canadians want to know if they're going to be able to go to their home arenas in Canada. If there's a vaccination threshold in the area or a case count, I think that was more. I appreciate the thorough answer on cross-border, but.
Well, perhaps I can step in yet again and then turn it to Dr. Njoo, because I do think it is an important distinction, and I do think it is important to clarify that it wouldn't be the federal government that would release the public health measures in that jurisdiction. Yet again, I think it's very important to remember that public health measures, including gathering sizes and public events and sporting events and a variety of other public health measures, are all applied by the province and in some cases local public health. And the federal government would not have anything to say about the particular circumstances of that decision. But we do have something to say about the cross-border travel, and that's why we intersect in these decisions.
Thank you, Minister Hajdu. That's why I was sort of weighing in terms of the federal, but you're right. With fans in the stands, I think we made it quite clear in Canada we're taking a sort of a collective approach in terms of our vaccination campaign. The Prime Minister has a reference to the one-dose summer and what we might be able to do when we get hopefully up to 75% or more in terms of the population having received full vaccination, 2 doses in the fall, and also what that might mean in terms of gatherings, including as I think he mentioned in his opening remarks about looking at indoor sports and so on. So I would say that if you look at that timing and what's obviously the schedule for the NHL playoffs right now, which is taking place right now and into the summer months, that it's not really something that's under sort of serious consideration in terms of fans in the stands, just based on sort of where we are with our vaccination campaign at this point. But as the Minister has said, certainly we defer to the provinces and territories in terms of local public health measures, what they want to put in place. The fact that we're discussing even the cross-border issue with the NHL and the provinces are involved, discussions are ongoing, but certainly with the fans in the stands, I think the comfort level, especially because it's indoors, I think I think the risk tolerance would be a lot lower than compared to, for example, to something that would be a sort of an outdoor event at this point. Thank you.
We'll take one last question.
Abigail Beeman, Global News. Question for the doctors and the Minister, if you wish to weigh in. Just a broad look question. What do you expect in terms of a timeline for this third wave ebbing, normal life returning, and at the same time, what do you believe the prospect is for a fourth wave or cases persisting in the fall?
Maybe I'll start.
Perhaps that's a good question for Dr. Tam.
Yes. So as we said at the beginning of this press conference, we're beginning to see the sort of positive signs in many of the jurisdictions that they're on the downward side of that epidemic curve, but some are not yet. So Manitoba, for example, was a bit later in the start of the third wave, and we'll have to see what's there and health measures that have been applied. The most important factor in the deceleration of the epidemic curve is the application of the public health measures in the provinces and territories. How fast we go down that curve and whether we get to the bottom of that curve is contingent upon the work that they're doing together with their communities. But at the national level, we have been essentially messaging that you have to be really careful with variants at play while vaccinations are going up. We have to be very cautious about that downward path. With that in mind, I can't tell you right now when we'll get to the bottom of this. Last time we only got to 2/3 of the way down the curve, and then with some relaxation of restrictive measures, we went back up again. And so there's still a chance that could happen if we're not careful. Our modeling suggests that with 75% first dose and at the same time 20% at least of the second dose, vaccinating people that second dose as fast as possible can lead you to a lifting of measures without overwhelming the health system. So we're not quite there yet, but I am really hopeful because of how fast some of the vaccines are going into arms. And, I think we were looking at that 50% mark, and then it's imminently possible that in the next weeks, we're going to get to that 75% plus 20%. So that's I think, a reasonable target to look for. But it's really up to local epidemiology in terms of that easing. And we just got to be really careful.
For you, Dr. Tam. One final question for you, Dr. Tam, here. Maybe you can give us the most current number on VITT cases and deaths in Canada, and do you know when NACI will be ready with the advice on second doses for AstraZeneca recipients? Thank you.
Yes, so at the moment we have 34 reports of blood clots together with low platelets following the vaccination with AstraZeneca vaccine. Of these, at the moment, 21% of them have the positive lab tests, which confirms the VIT, vaccine-induced thrombocytopenia. So it's 21 confirmed cases, if you like. But we're still then investigating 13 that are awaiting laboratory tests. Unfortunately, 3 individuals have died from this rare but serious condition. And so all of these cases are being taken seriously. And there's no very obvious sex distribution. There's 15 females and 18 males amongst that group that's been just reported. So with that in mind, of course, the National Advisory Committee on Immunization have been providing provinces with a framework, a benefit risk framework to work from, looking at the epidemiology as well as the rates by age for the epidemiology, really, because more serious outcomes occur in the older age groups from COVID-19, and you have to balance that against the risk of VIT. So of course, the question that people are waiting for the NACI advice on the mixed dose, I think we've heard that the UK study will be, we're expecting the immunogenicity or the immune response of those study recipients. We think by the end of this month or beginning of June, but I can't say for sure because it's a study in another country. But in the initial publication suggests that the vaccine, this combination looks to be safe, although there's more reactions from those who received the Pfizer vaccine after AstraZeneca. But we need to look at that more closely. And then with the the study coming from Spain will be trying to get that information analyzed as soon as possible. All to say is just to reassure Canadians who've received that first dose of AstraZeneca that there will be a second dose of AstraZeneca should they choose that with informed consent. And then we will come back with the answer about the mixed dose schedule shortly. And for the majority of them, the answer should come before they need that second dose.
Thank you, Dr. Tam. Thank you, ministers. This is what ends today's presser.
Thank you. Bye.
Thank you.